Patients undergoing breast augmentation will often ask me, is it better to get a teardrop or a round implant? And the reality is they're both likely to end up in a very similar cosmetic result. The benefit of the teardrop or anatomic implant, it has more volume at the bottom. But there's actually a study done. We have devices that are called sizers that perfectly replicate what the implant's going to look like that we use in surgery. And there was a surgeon who put a teardrop shape on one side and a round implant on the other side and then sat the patient up. And they showed these photos, patients consented to be part of this, to plastic surgeons and lay people, and no one was able to tell which side had which. Because the reality is the shape of the implant isn't really that important if you have your own breast tissue and an augmentation sitting on top of it, because the breast will still adopt that breast shape. And the problem with the teardrop implants is that in order to keep them right side up, they need to have this textured surface that functions a little bit like Velcro, and that textured surface in rare cases can cause a type of cancer of the immune system called lymphoma. And so most surgeons at this point will just use the typical smooth round implants for an augmentation, and you're likely to get a very similar result as if you had a teardrop.